Hello, my name is Trevor and I have created this informative video on the glenohumeral joint as part of the course requirements of human anatomy at Saddleback College. The glenohumeral joint, more commonly referred to as the shoulder, is primarily composed by the articulation of two appendicular skeletal bones, the humerus and the scapula. Anatomically, the glenohumeral joint is formed as the head of the humerus sits comfortably in the slight depression of the scapula called the glenoid cavity. The depression of the glenoid cavity is further extended with the help of a fibrocartilage ring called the glenoid labrum. The labrum contributes to the flexibility and stability of the shoulder joint. The shoulder joint is reinforced via a series of ligaments that span from the acromion, coracoid process, supra and infra glenoid tubercles of the scapula to the greater and lesser tubercles of the humerus. Being one of the most freely movable joints in the human body, the glenohumeral joint is a ball and socket joint which allows movement multi-axially in all three body planes: frontal, sagittal, and transverse. On the basis of such a large range of motion, the shoulder joint is appropriately classified as a synovial joint. As such, there is an articular capsule incorporated into the shoulder joint that is partially responsible for increased strength as well as the production of synovial fluid, providing lubrication for smooth articulation. Furthermore, the articular capsule extends from the margin of the glenoid cavity to the anatomical neck of the humerus and contributes to the overall flexibility of the glenohumeral joint while consisting of a rather thin and weak layer of tissue. Aside from being referred to as the shoulder joint, the glenohumeral joint is also synonymously referenced when discussing the rotator cuff. The rotator cuff is comprised of 5 muscles that allow for movement of the humerus as well as the arm as a whole. The musculature of the rotator cuff is the subscapularis, teres major, teres minor, infraspinatus, and the supraspinatus. Overexertion of the glenohumeral joint, such as in repeatedly throwing a baseball, commonly leads to stretching of the rotator cuff muscles and subsequent injury. Another muscle that works synergistically with those of the rotator cuff is the deltoid, originating primarily on the acromion and spine of the scapula, as well as the clavicle. The deltoid inserts into the deltoid tuberosity of the humerus. The deltoid stabilizes the shoulder joint and acts as a prime mover for the humerus for abduction and, to a lesser extent, rotation, both medially and laterally, flexion and extension of the arm. From a skeletal perspective, of the 2 bones that make up the glenohumeral joint, the humerus is more commonly injured. Fractures to the humeral head and the surgical neck may likely be the result of a traumatic injury where one may attempt to catch themselves from a fall. Where the glenohumeral joint gains in the extent of free range of motion, it lacks in that the structures reinforcing this joint are the weakest anteriorly and inferiorly. As a clinical result, shoulder dislocations are common injuries where the humeral head dislocates forward and downward. As with other joints, once a dislocation has occurred to the shoulder joint, future occurrences may not be uncommon.